Welcome to the office. Okay, sir, I'd like you to walk back and forth for me, okay?
Okay.
And this is your normal walk at the moment, correct?
At the moment, yes.
Okay. And you had an injury back in 2015? 2016?
2015.
2015.
Well, no, the injury was in 2012,
Okay.
but this started in 2015.
And it's been like this since?
Yes.
Okay, keep walking, please. So he has to lift up a lot on that left side. Come over here so I can open the back of your gown so we can see the dimples moving. Take your time, sir. Come back. Come back. All right. Are you okay, sir?
Yeah.
All right. So this is also, there's a balance issue. You had low back pain, correct?
No pain.
Sorry, balance.
Yes.
And when you were walking, this wasn't responding, this side.
Yes.
Okay, so let's go ahead and walk, please. And you saw quite a few doctors, and at the same time, you had some surgery done on your back.
Yes.
And you had L4 discectomy. They cleaned up some of the L4. That's where they said your herniation was, correct?
Yes.
All right. Okay, let's go over here to your x-rays, sir. And let me explain what I'm seeing. We did the full consultation earlier, and I want to get right into the x-rays and try to figure out some of these things. You can sit whatever's comfortable. This is a picture in time, sir. It tells us how you've evolved from birth. 24 bones in the spine, 23 discs in between. This is a 24-story building. This is the foundation of your 24-story building. I started to mark something here. I just need to finish the numbers of the pelvis. And we have 232. And we have 234. And on the rotation, we have 4 millimeters. 232, 234. We have it rotated to the left side. So we have an AS2EX4. Okay, and then as we look here, we have a slight short leg on the left side. And that short leg is 5 millimeters. Measured difference equals 5 millimeters. Actual difference is 4 millimeters. Okay. But here's where I'm seeing the answer. Now let's go through this, okay? I will explain this foundation. If we don't have a level base and foundation, then the rest of the building doesn't really hold. You know that part. But here's what I need to go over. I told you, looking at your film, we had some old tailbone injuries. But I get that you're not recalling, and I'm telling you these are old tailbone injuries. You went in 2012 to 2015, you were going through that, and they found a herniated disc at L4, correct?
L4, L5, yes.
L4. So when they're saying L4, L5, they're saying the bone of L4 over L5, and that's the disc they're referring to. Now, and you can see the scar tissue from whatever surgery they did. The disc is still good, by the way, okay? The disc is fine. And I said this is an old tailbone injury, but you're like, but I didn't have any pain. I was very active. That was your comment. And that's fine. You had something predisposed, so whatever happened in 2012 aggravated something that was already there and you were already compensating for. Take? Okay. Now, this is a common thing you may have seen me talk about in some of the previous videos. You did a non-weight bearing MRI. You were on your back, correct?
Mm-hmm.
Or you were seated on your back. You were in a tunnel, right?
Yes, on a tunnel.
Yes.
On my back.
But you weren't sitting.
No.
Or standing.
No.
Okay. And this is what I'm seeing. So I measured the numbers here. We don't have rotation of your sacrum. You have a 7 millimeter deficiency of your sacrum. Your sacrum is tilting down like this, and it's causing this kink. Follow my process. It's tilting like this. When we start to see an inferior sacrum, doesn't matter which side, that's number one. Number two, I'm looking at the tailbone, and it should be a smooth arc. We got a nub here, we got a nub here, here, and here. You had some good falls, or you were a very active kid. Okay? Follow my process, please. So what I'm seeing is this is an initial old tailbone injury we need to figure out. If this isn't stable, we got no business working up there. Okay? Now, if we want to go deeper, it's right here. Dejo. This is your 5 disc, L5S1 disc. Okay? This is a sacrum issue, brother. It's here. So 5 looks like it's tilting back. It's sacrum that's behind. Your issue is your sacrum. Now, I circled down here. There's a kink in your tailbone here. And this is what's causing, again, this curvature to appear like this. Okay? So we have a short leg on this side, on the left side. We have a slight pelvic imbalance, and all of this coming from a drop sacrum on the left. ASEX also tells me the numbers. So the way the pelvis works in opposite, up and one goes up, the other goes down, one goes out. ASEX, the shape of the joint, tells us what? The shape, this is an auricular surface. And the shape of the joint dictates the movement of the SI joint. When it goes down, it naturally wants to go out. When it goes up, it naturally wants to ride in. I'm referencing this dimple, the PSIS, to the sacroala. If it's gone ASEX, it means it's done what? Up and out. Up and out is a trauma. That's a fall. So whether you're telling me or not, I'm telling you what I see mechanically first. Take?
That's all I remember.
No problem. No problem.
Yeah.
Okay? But I'm just pointing it out for you, sir. Now, let's continue. Once we, look, it's like this, but it should be like this. The next one to go off once this is fixed is your 5. 5 is level based on this. But if I fix this, 5 is off. Okay? Right now, if I get pressure at 5, I'm not touching 5. But what I want you to see is this. From 10, all of this is compensating for your tailbone sacrum, not 4 or 5. Now, as this comes up, it's going to change this whole thing.
Yes.
But at the moment, this is what it's showing. In this scenario, 3 is the level for the sacrum. Okay? The next one to go off is going to be 9. And 9 is throwing off the rest of the spine up top. That's an X-ray. I'm going to examine you. We're going to find where the pressure is. Then I'll go and I'll start working more on the listings of the misalignment.
Okay.
I don't see me running around here right now. Okay, I see me focusing here in the basement, balance, penthouse. Okay, that's what I see in terms of this. On this X-ray, let's talk about this now. These are old compression injuries, sir. You did heavy work, or
Yes. Yes.
You did heavy work.
Yes.
Posture, let's talk about it. And this is based on your balance and pain at the moment. Now, ideal posture. 5 is supposed to line up with 7 and 2. What does this tell us? So most of the X-rays I show, they're behind. You have your body in front of you like this, the neck. So you're more like this. Okay? We'll get to more of that in a minute. We are designed to have 60-degree reciprocating curves. We need a little more curve into here. And all of this, I don't want to get into more of this right now. I want to focus on this right now. Let's focus on your foundation. We have an issue at 6. You have a lot of compensation. I'm going to leave that. Let's examine you, please. Okay? And then I'll come back to this. Because I can start pointing out all these little things. And all of it is a result of foundation.
Can I add one more thing?
Please.
All right. So after the surgery, every time I eat something,
Yeah.
and
Turn around. Let's talk.
and if I'm standing, and my things start getting weak, my left leg,
Yeah.
I feel like everything, whatever I eat, well, I mean, I don't even eat a lot because of this reason. But if I eat and my tummy start getting puffs
Swollen?
out, yes, and my leg gets getting weak, my left leg, I feel like everything just start coming up to my heart.
You get acid reflux with it? Heartburn?
No heartburn,
Okay.
but I had to sit down right away because I feel like something's gonna happen to my heart or something like that.
So you get bloated first.
Yes,
Then you get weakness in your leg.
yes.
And then you feel
And then
like
I feel like whatever I eat, they're just coming up.
then the intra-abdominal pressure starts to go up towards the chest and it's putting pressure on your chest. Right?
Yes.
All right. Let's get started. Starting at the base of the neck. And the first thing I'm getting, sir, is looks like it's breaking left, but it's actually breaking right. Swings left, then right. Ooh. Right, sir. You working right now?
No.
Okay. Chilling, hanging out, watching cricket?
No, I'm all stressed. I can't even enjoy my life.
I mean, I get it, sir, to come down here. You took time, you brought some for your friend with you?
My little brother, my younger brother.
Okay, cool. There it is. It's down low, S4. S4, maybe S5, left side. It's your left leg, right?
Yes.
Oh, it's nice that it matched. Okay, sir. Let's go ahead and do static palpation. Head down just a tiny bit, please. And running my fingers down the spine. Ah, there it starts, brother. Right there. You see that puffiness right there? Yeah. There it is. And then it disappears into the spine. 1, 2, 3, 4, 5, 6, 7, 8. Tender here. I feel this one. It's a little tender here. A little pain.
Little bit, yeah.
More here at the top, more at the bottom.
More the top.
This one,
Right
yes?
there, right there.
How about this one here?
No.
This one, yes.
Yes.
Okay, let's count again, please. 3, 4, 5, 6, 7, 8. Number 9. Scoot forward, please. Let's check your low back. Feet together. All right. Feet together. There's that little blemish or scar from the surgery. Your feet are touching the floor, sir?
Yes.
Take. Feet together. I'm on the PSIS, medial aspect. Open and close your knees, please. Open and close. Sit up a little straighter for me, please. There you go. Left side only. Your feet are touching, yes?
Yes.
Good. Right side only. So when he does the right, there's more shifting of the left under my thumb. When he does the left side, do the left side only. The right is fine. Scoot back for me, please. So we do have this left SI joint. Now let's check the motion back towards me. Punch. That's 4, okay?
Okay.
4 is fine. That's 5. 5 is fine. 1,
Yes, that hurt.
2. This is where I'm getting it. Starting here. Do you feel this, sir?
Yes.
Okay. Now, I'm going to go down one more, okay? How's that one? Not as bad.
No, no.
4 or 3?
This one.
3.
Yes. Yes.
2, 2.
Yes.
1.
Yes.
1, 2, 3. Da, 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 da. Okay, what else is that? 1, 2, 3. 3. S3 is where we're going to start at the bottom. S3, T9. But let's see what's up top there. Sit back for me, please, sir. Head down. 6, 5, 4, 3, 2. Ik. Tender.
Yes.
Tender.
Not that much.
I have to push harder here, but this side for sure.
Yes. Yes.
Okay, sir. Let's see what we got. ASLA Atlas left. T9. T9 is A. PLS. ASLA and a sacrum. S3. And we have left pelvis. So we have 4 things. We're not adjusting all 4, but we have 4 majors. I'm going to repeat. Left atlas, T9, S3, left pelvis. Take. We'll start with the neck. We got to get the messages down and with the basement. After that, I'll have you get up and walk a little bit, rescope you, and then we'll see if we're going to do 9 or not today. And then whatever else we need to work on. Okay? Nice and easy, sir. ASL. ASLA. Here's what's different with an ASLA. If I was doing just a regular ASL, it's here. If you're doing an ASLP, it means it's gone back. You got to turn this way. With an ASLA, you got to actually come slightly in front and bring the nose back a little. And by bringing it back, you put it back at neutral. There you go. Nice. Sit up straight, please. You got some quick reflexes, dude. It's good. Let's go back. Let's go on the gray table, sir, over here. So we got inferiority left side. We're going to have to do a lot of clockwise torque. All right. So it's clockwise. This way. This way. Let's see what we got here. Oh, that's your home run, brother. I got you. I got you, brother. I got you. That's what you needed, sir. Let it go. Step away, sir. Sir, that's why you came here. That was a home run, my friend.
So what was that?
That was your S3. Come off slowly. Hold my hand. I want you to actually sit. I don't want you to walk yet.
Okay.
I want you to sit first. Take your time. No rush. No rush. And here, go like this, up and down with your knees. Just get movement. Keep going. Keep.
Can barely pick up my left leg.
Understood. That's enough. Now let's. Is it heavy or just no power?
It's heavy.
Heavy. Okay.
Yes.
Let's continue. Neck is clear. 9 is still there, okay? We're going to deal with that. Let's see the bottom. हाँ ये बात है ये बात है साफ सफाई हो गया. Sit up straight. I'm going to still do 9, but I want you to see the low back right now. देखो, come back, punch. That's 5. Remember 1? Same or different?
Different.
This is the 1.
It still hurt, but not as much.
2. This is the one I adjusted. 3. Okay, let's go back and do your T9 now, sir. PLS. Back on the gray table, please. T9, PLS. Gotcha. Nice. Give me your hand, sir. Come off slowly. Have a seat, please. So right now, have a seat at your convenience. Let me check the spine. As soon as I'm done, then I'll have you walk. Head down, please. So, as I said, the pressure has been there a while. He's had some work done on him. What I'm doing right now is we got to clear the spine. Then we got to see how the body's going to respond. Good. Icing is going to be one of your best friends, okay? Ice the areas that I adjusted. I'll give you ice packs here. And all clear, brother. Now, go ahead and walk for me, please. That's where we're going to start. C1, S3, T9. And just normal walk or regular walking back and forth. Okay.
Little better.
I'm not going to say nothing right now. It's been there a long time. The power is going to get on. You're going to ice. Tell me what's different though.
In my left leg, instead of putting it flat, every time I put it, it comes like this.
Right.
I'm pretty sure you noticed that too.
Yeah. What's different right now? Anything different?
A little bit light.
Okay.
Yeah. But my leg issue is still there.
Yeah.
There is barely any flexibility.
And so we're clear. I don't expect that in 1 or 2 visits this is all going to change. I'm trying to help you figure it out right now.
Okay.
Okay? So symptoms will be there. What's misleading in his case, he really has to hike up that left side. His leg, he really has to lift the whole left pelvis up. And when you look at his x-rays, he does have a short leg in ASEX, but it doesn't explain that really, okay? So let's see what happens over the next 24 hours.
Okay.
And then tomorrow, and you're here for till Friday, so let's see what it is, okay? Do you understand though what I found, sir? Do you understand what I found?
Yeah.
Yeah? Then I want you to actually come back and I want to rescope it just to make sure nothing goes out. Actually, let's try one more thing. Can you go on the floor? Use the door, the chair, whatever you need to. Just sit on the floor. Sit on the floor, however you need to.
My leg out.
Whatever. Just if you're going to sit on the floor, however you're going to do it. Okay. Taking a couple of nice deep breaths. One more. And now I'd like you to get up the best you can. Use the door handle, use the chair. Don't help him, please. Was that any different for you?
No, not really.
Okay, no problem. Have a seat. Good feedback. All right. Just want to make sure nothing came out of the low back. Mm-hmm. Mm-hmm. Scoot forward, please. Let's check the left pelvis now. Feet together. Open and close your knees. Move the right side only, please. Okay. So now when you're doing the right, there's less movement of the left because it's freed up a tiny bit, okay? When you were doing it before, the right side, the whole left was shifting with it because the left side is stuck, okay? That's where we're gonna start. Stand up for me, please. Squeeze. Elbow. Relax there. Relax there. Cracks and jokes and all that's fine, but we gotta get work done. Squeeze. Good. Squeeze. Sir, that's where we're gonna start. Any questions for today?
No.
Okay. Any questions? Oh, you're good. Okay. Welcome to the office.